Darren.
Farron.
Mark.
Becky.
Daniel.
Dorothy. What do you think when you hear the word cancer? I know when I hear the word cancer, my spine tingles. Almost everyone is affected by cancer somehow, whether it's you directly or a family member or a close friend. My reasoning for researching lung cancer is because my aunt was just recently diagnosed with it. Lung cancer is abnormal cells in the lungs that keep them from functioning properly. Lung cancer is divided into two categories. Non-small cell and small cell cancer is divided into two categories, non-small cell and small cell. The American Cancer Society says lung cancer is the second most common cancer in both men and women. Most of us know the treatments for lung cancer is radiation and chemotherapy. To understand the remarkable beauty in these new treatments, you should understand what lung cancer is and how it affects the body. Lung cancer can happen in one or both of the lungs. Lung cancer is the uncontrolled growth of abnormal cells in the lungs. These cells do not function properly within the lungs. However, they do grow like a normal cell would and divide, giving their abnormal strands to their new cells. When these cells grow, they form tumors, and these tumors interfere with the function of the lungs. Cancer is caused by mutations in DNA, which is caused by smoking, or just part of the normal aging process. According to Cancer Care, a program that keeps lung cancer information current and correct, says researchers have found that it takes a series of mutations in these cells to create a lung cancer cell. Therefore, it becomes cancerous, and then it can be precancerous, meaning that it has mutations but still functions normally as a lung cell. At some point, these cells may travel somewhere else in the body and become tumors. Once the tumors in the lung become cancerous, it's classified into one of two types of cancer, non-small cell and small cell cancer. Non-small cell cancer is the most common. It is the lung cancer that has three types: squamous cell carcinoma, adenocarcinoma, and large cell carcinoma. The other type of lung cancer is small cell lung cancer. Even though this type is the less common of the two, it's more deadly because it spreads and multiplies faster than small cell lung cancer. Cancer is pretty common in today's society. Almost everyone has been affected by some sort of cancer. However, I just want to focus on lung cancer. Non-small cell cancer is the most common. According to the American Cancer Society, about 85 to 90% of lung cancers are non-small cell cancer. That 85 to 90% is broken down into three types of non-small cell lung cancer. The squamous cell carcinoma is linked to smoking, and the American Cancer Society says 25 to 30% of lung cancers are squamous cell carcinoma. Next is adenocarcinoma, which is the most common in non-smokers, and the American Cancer Society says it makes up 40% of non-small cell cancers. The American Cancer Society says that large cell carcinoma makes up about 10 to 15% of lung cell cancer. The second least common of the lung cell cancer is small cell lung cancer. This type of cancer makes up 10 to 15% of lung cancers. The estimates for cancer in the U.S. in 2013, according to the American Cancer Society, are about 228,000 new cases of lung cancer will be diagnosed, and the estimated 159,000 deaths from lung cancer. The American Cancer Society says 2 out of 3 people diagnosed are 65 or older, and fewer than 2% are found in people 45 and younger. The average age at the time of diagnosis is 71. The treatment and medicine for lung cancer patients depends on the type of cancer and the person that is diagnosed. Lung cancer is difficult to treat, one reason being it's usually diagnosed after it has started spreading, mainly because there are no early symptoms. Lung cancer treatment is changing thanks to new research and treatments. The newest research is vaccines. Vaccines are said to be used to treat lung cancer and even decrease the risk of lung cancer. Scientists have found a way to trigger the immune system to destroy the lung cancer cells. Another way to treat lung cancer is chemotherapy. According to the Lung Cancer Alliance, chemoprevention is the use of substance to prevent lung cancer from developing. So far, researchers have no conclusion due to mixed results from their studies. The next new treatments are those that involve the use of drugs. Celebrex is a drug used to relieve arthritis pain by blocking the chemical COX-2. COX-2 may play a role in the development of lung cancer, so Celebrex is being studied as a possibility to decrease the risk of lung cancer. There is Abroxan, a drug being studied for the use in small cell lung cancer. The Lung Cancer Alliance says this drug has shown some benefits in clinical trials, including fewer side effects and a better response time. Amibusine is a drug being studied for use in small cell lung cancer. The Lung Cancer Alliance says it is an anti-cancer drug known to be highly effective in cancer chemotherapy, and it doesn't have the risk of the heart-damaging side effects. Fox Chase Labs also have been working on drugs to help patients with lung cancer. The first drug is Tarceva, which is used to block the pathway to which tumors used to grow. The second drug is alisertib, which prevents the chromosomes from splitting and causes the cell to die. I was so upset when I found out my aunt was diagnosed with stage 4 small cell lung cancer, so I immediately started to research on my own and to find out what it was and how it was treated. I found that lung cancer is the abnormal cells in the lungs that keep them from functioning as they should. I also learned that lung cancer is the second most common type of cancer in both men and women. With all the new treatments available, I am hopeful that they can help her fight until the scientists find a cure.